Hi, my name is Dr. Manali Andrus. I am a pelvic floor physical therapist here at Legacy Physical Therapy, and today I want to highlight something that a lot of people don't think of, which is pelvic physical therapy for men. Both men and women have pelvic floors, and so a lot of times people think that pelvic floor physical therapy is reserved just for women for maybe pregnancy or postpartum issues. But I want to highlight today that that is not true. There are conditions that impact both men and women within the pelvic floor, and a lot of men don't seek the treatment that they need until they're really suffering for a long time. So, I want to highlight the most common reasons that we see men here at Legacy for pelvic floor physical therapy. So, if you're experiencing any of these, you can get treatment faster. So just to review, the pelvic floor is a group of muscles that kind of make up the bottom of our pelvis. They stem from the front pubic bone area all the way back to that tailbone. And so these muscles are really vital in the functionality of your bladder function, bowel function, or sexual function. And so when there is any dysfunction going on, this can really impact all three of these areas. So the top reasons that we see men in the clinic for pelvic floor physical therapy are: one, it's going to be post-prostate surgery. So the prostate is a gland that is really important in maintaining continence within your bladder function. And so when that is removed surgically, a lot of times men will have issues with leakage or frequency that is really bothersome. And so studies have shown that men that do go to pelvic floor physical therapy after surgery gain continence a lot quicker than men that do not do this. The second reason that we tend to see men in the clinic is pelvic pain. And so that can be any pain that is present through the tailbone, the penis, the testicles, any of that pelvic floor region. A lot of times the pelvic floor muscles can be a source of that pain. And so we do a thorough exam to see what's going on, what's causing those symptoms, and we treat that. The third one is any constipation or bowel leakage that's occurring. The pelvic floor muscles really have to do with a lot of that function of making sure you're going to the having bowel movements that are regular without any straining. So if you feel like you're spending a lot of time in the bathroom, a lot of straining that's occurring, or you're having any leakage, the pelvic floor can be a source of that. And that's something that we can train to make sure that you're going more regularly and not having any issues with bowel movements. The fourth one is any bladder leakage frequency or urgency that you're having. This doesn't necessarily have to do with the prostate itself, but the prostate gland can really be a big source of why you're having issues with urgency, frequency regarding the bladder. But a lot of times the muscles itself are a big role in that as well. So if you feel like the prostate's been checked, there's no issues with that, but you're still having a lot of issues, the pelvic floor muscles are almost always a big kind of component of that. So that's something that we'll do an exam on to see if there's any weakness or tension that's present, and treat that to see if we can get you having a good bladder emptying pattern. The last one is hernia or abdominal wall weakness. A lot of people don't think of this as being something that needs to be treated. Sometimes there's a surgery that's been done and they've been told you're good. But if there's still abdominal wall weakness that's present, that can really kind of cause that hernia to come back or re-tear. And so a lot of times we do a lot of treatment regarding strengthening the abdominal wall and the pelvic floor to make sure that that abdominal wall is strong and it doesn't lead to any reoccurrence of hernias. So if you're experiencing any of these symptoms that I just talked about or anything else, we offer free discovery visits to privately come into the clinic or even on the phone, talk to one of us, our physical therapists. And so we can really talk through some of your issues and see if that's something that we can help you with. So hope to hear from you. Have a good day.